helplessness and emotional pain. The brain interprets this as danger and sends a powerful urge to seek relief, often through the addictive substance. This emotional pressure overrides the rational part of the brain, making relapse more likely. Even small triggers, like stress at work or a difficult conversation, can activate this emotional loop, pushing the person back toward the addiction. The brain has now learned that the drug or behavior is the fastest way to calm down, even if it causes long-term harm. Additionally, the hippocampus, responsible for memory, also plays a role. It stores memories associated with the pleasure of drug use or addictive behavior. These memories become deeply ingrained and can be activated by environmental cues, a certain place, smell, song, or even a group of friends. When triggered, the brain lights up with craving, pushing the person toward relapse, even if they've been clean for weeks or months. These brain changes are long, lasting, and in some cases, permanent without proper intervention. What's more alarming is that the brain starts to develop a new belief system. It begins to prioritize the addiction over survival. The addicted brain convinces itself that the drug or behavior is essential, sometimes more important than food, shelter, family, or safety. This explains why people with addiction might risk their health, finances, or relationships. Their brain has restructured its reward hierarchy. In clinical terms, the brain has undergone neuroadaptation. It has adapted itself to a new reality where the substance is central to its functioning. Treatment for addiction, therefore, is not just about stopping the behavior. It's about retraining and rewiring the brain. Recovery programs aim to reduce the control of the reward system and strengthen the prefrontal cortex. This takes time. Detox may remove the substance from the body, but the brain circuits that drive the behavior take much longer to change. Psychotherapy, group counseling, and behavioral therapies help by introducing new patterns of thinking and behavior. Medications can also assist by reducing cravings or stabilizing brain chemistry. Neuroplasticity, the brain's ability to rewire and form new connections, is the foundation of recovery. With consistent support and healthy habits, the brain can slowly begin to restore its original balance. Activities like exercise, meditation, learning new skills, building relationships, and getting proper sleep help regenerate dopamine levels in a healthy way and re-engage the prefrontal cortex. Over time, these new pathways can become stronger than the old addiction-related ones. Understanding how addiction hijacks the brain's reward and decision-making systems removes the stigma that surrounds it. It reveals that people with addiction aren't just making bad choices. They are battling a disease that changes their brain chemistry and behavior. The decision-making ability that most of us take for granted becomes compromised, and the reward system, meant to help us survive, ends up reinforcing destructive patterns. By approaching addiction with compassion, medical support, and a brain-based perspective, we can offer real help to those who are suffering. Recovery is not just possible. It is the natural result of healing the brain step by step with time, support, and understanding. Many people who suffer from addiction also struggle with mental health issues, whether diagnosed or undiagnosed. In many cases, the mental health issue comes first. A person suffering from anxiety or depression may turn to drugs or alcohol in an attempt to self-medicate. They may not even be aware that they're doing it. They simply feel bad and find that a drink, a pill, or some other substance helps numb the emotional pain or quiet their thoughts. Over time, that relief becomes something they depend on, and this repeated pattern turns into addiction. The brain begins to associate the substance with temporary peace, and that becomes the primary way the person manages their emotions. It's also common for the opposite to happen. A person may begin using a drug recreationally or out of curiosity, and the drug itself begins to alter their brain chemistry in a way that triggers mental illness. For example, prolonged use of methamphetamine can lead to symptoms that closely resemble paranoid schizophrenia. Similarly, Alcohol is a depressant, and heavy use can deepen or even cause symptoms of clinical depression. Over time, the brain's natural ability to regulate mood, process emotions, and manage stress is damaged by the substance. What might have started as occasional use becomes a necessary habit, and mental health begins to deteriorate alongside the addiction. One of the most important facts in this area is that both mental health disorders and addiction affect the same regions of the brain, particularly those involved in decision making, impulse control, emotional regulation, and stress response. This overlap explains why these conditions are so often linked. The prefrontal cortex, for example, helps a person make thoughtful decisions and regulate their emotions. When this area is affected by depression or anxiety, a person may already struggle to think clearly or cope with stress. When addiction is added to the picture, that same brain area becomes even more impaired, making recovery feel almost impossible without help. Trauma is another major bridge between mental health and addiction. People who have experienced physical, emotional, or sexual abuse, especially in childhood, are significantly more likely to develop both mental health problems and addiction. Trauma can leave deep scars in the brain's emotional processing centers, such as the amygdala and hippocampus, which regulate fear, memory, and stress. When a person is unable to process their trauma in a healthy way, substances often become a form of escape. Drugs and alcohol can dull the intensity of traumatic memories or emotional pain, but only temporarily. Over time, the trauma remains untreated, and the person becomes addicted to the very thing they used to escape it. In such cases, healing from addiction requires addressing the root cause, the unresolved trauma. Alongside the addiction itself, another critical issue is how stigma and misunderstanding make this situation worse. Many people with mental health disorders feel ashamed or embarrassed. They don't seek help because they fear being judged, misunderstood, or labeled as weak. When they turn to drugs or alcohol for relief, society often sees them only as addicts, ignoring the emotional suffering that led them there. This lack of compassion and understanding isolates them further and can actually worsen both conditions. Addiction is often treated as a moral failure and mental illness as a personal weakness, but in reality, both are medical conditions that require proper treatment and support. When it comes to treatment, addressing both the mental health issue and the addiction at the same time is crucial. If only one is treated, the other may cause the person to relapse. For example, if someone is treated for drug addiction, but their underlying anxiety disorder is ignored, the intense stress and fear caused by anxiety can trigger a return to substance use. On the other hand, if depression is treated, but the person continues to drink alcohol heavily, the benefits of therapy or medication may be completely undermined. Integrated treatment is the most effective approach. This means therapy and medical care that treat both conditions together, acknowledging their relationship and how they affect each other. Different therapies are designed to do exactly this. Cognitive behavioral therapy, CBT, for example, helps individuals understand the thoughts and beliefs that drive both their emotional suffering and their addictive behaviors. It teaches skills for managing negative emotions, recognizing triggers, and developing healthier coping strategies. Dialectical behavior therapy (DBT) is also very effective, especially for people who experience intense emotions or self-destructive behavior. It combines mindfulness, emotional regulation, and interpersonal skills to help people stay grounded and make better choices in the moment. Medication can also be a helpful part of integrated treatment. For instance, antidepressants can help stabilize mood in someone with depression or anxiety, making it easier for them to engage in therapy and resist cravings. Other medications, such as naltrexone or buprenorphine, can help reduce the urge to use opioids or alcohol. These medications don't cure addiction or mental illness, but they support recovery by helping to stabilize brain chemistry and make healing more manageable. Peer support groups like narcotics, Anonymous NA, or Alcoholics Anonymous AA, can be powerful sources of encouragement and accountability. Similarly, groups that focus on mental health, such as Depression and Bipolar Support Alliance (DBSA), provide safe spaces for people to talk about their struggles without fear. For instance, antidepressants can help stabilize mood in someone with depression or anxiety, making it easier for them to engage in therapy and resist cravings. Other medications, such as naltrexone or buprenorphine, can help reduce the urge to use opioids or alcohol. These medications don't cure addiction or mental illness, but they support recovery by helping to stabilize brain chemistry and make healing more manageable. Peer support groups like Narcotics Anonymous NA, or Alcoholics Anonymous AA, can be powerful sources of encouragement and accountability. Similarly, groups that focus on mental health, such as Depression and Bipolar Support Alliance (DBSA), provide safe spaces for people to talk about their struggles without fear of judgment. For people with both conditions, finding a dual recovery support group, where addiction and mental health are addressed together, can be life-changing. One important message to remember is that recovery is not a straight line. People with both addiction and mental illness may face setbacks. They may feel like they're getting better, and then experience a relapse or a mental health crisis. This doesn't mean they've failed. It means they are human, and they need more support. Every step forward, no matter how small, is part of the healing journey. In the end, addiction and mental health disorders are two sides of the same coin. They influence each other, complicate each other, and often arise from the same emotional pain or neurological vulnerabilities. But the good news is that they can both be treated. With the right combination of therapy, medication, support, and understanding, individuals can recover, not just from addiction, but from the emotional wounds that may have led them there. By seeing addiction through the lens of mental health, we move closer to compassion and ultimately to true healing. When someone uses a substance repeatedly, whether it's alcohol, heroin, nicotine, or even caffeine, their brain gradually adjusts to its presence. Over time, the brain doesn't just tolerate the substance. It begins to require it to maintain what it now considers a normal state. The brain reduces its natural production of chemicals that the substance replaces or enhances. For instance, alcohol increases the activity of gamma-aminobutyric acid GABA, a neurotransmitter that calms the brain. In response, the brain produces less GABA on its own. When alcohol is suddenly removed, the brain is left in a state of hyperexcitability. This leads to symptoms such as anxiety, restlessness, irritability, and even seizures. This is just one example of how withdrawal disrupts the brain's chemical balance. Psychological withdrawal can be just as severe as physical withdrawal, especially in addictions that involve strong emotional or behavioral dependencies. For example, someone addicted to gambling, pornography, or social media may not experience vomiting or sweating like a heroin addict, but they may face overwhelming anxiety, depression, irritability, and feelings of emptiness. This psychological crash occurs because the brain, after being flooded with dopamine for long periods, has downregulated its ability to feel pleasure naturally. Once the addictive stimulus is removed, everything feels flat and meaningless. The brain struggles to find motivation, and this emotional deadness can make everyday life unbearable. This is what makes relapse so common during early withdrawal. The mind is desperately looking for a way to escape the emotional pain. Cravings are another major part of withdrawal. When the brain has become accustomed to receiving a high level of stimulation from a substance or behavior, it begins to anticipate it. These cravings are not just casual desires. They are urgent, overwhelming impulses that feel like life or death. The brain has linked the substance with safety, comfort, or relief, and when it doesn't get it, it sends out powerful signals to seek it. This is especially dangerous because even if a person has a strong desire to quit, their brain may override that intention with the false message that using again will bring relief or even survival. This intense internal conflict between wanting to recover and feeling like they need the substance is one of the most painful parts of withdrawal. The duration and severity of withdrawal symptoms vary based on several factors, including the type of addiction, the length of use, the dose, and the individual's ability to focus. Behavioral addictions, such as gambling or gaming, may produce less obvious physical symptoms, but often cause deep emotional withdrawal, including mood swings, insomnia, and loss of interest in life. Withdrawal also affects sleep, which in turn worsens mental health. People going through withdrawal often experience insomnia, nightmares, or disrupted sleep cycles. Poor sleep reduces the brain's ability to heal and regulate emotions, which can intensify feelings of depression, anxiety, and hopelessness. Without proper sleep, even a strong person can begin to feel mentally unwell. This makes withdrawal even more difficult to endure, especially without medical or emotional support. One of the hardest parts of withdrawal is that it is invisible. From the outside, it may look like someone is just cranky, lazy, or unstable. But on the inside, their nervous system is in chaos. Their brain is screaming for balance. Their emotions are out of control.